Welcome to today's program and thank you for joining us. I am C. Virginia Fields, former president of this great borough of Manhattan, and now as president CEO of the National Black Leadership Commission on Health, formerly known as the National Black Leadership Commission on AIDS. Back in 2019, the board voted to change the name to National Black Leadership Commission on Health. And this was done because we wanted everyone to more fully understand the broad range of the work that we do here at Black Health. And so the name was changed to the National Black Leadership Commission on Health. And not only then do we include a focus on HIV, but also continue with hepatitis C, cardiovascular disease, breast cancer, prostate cancer, diabetes, mental health, and sickle cell. Based on the data, those are the 8 leading diseases that disproportionately impact Black African Americans and population that has a higher mortality rate as compared to other race or ethnic groups. So with that, this was a major change in our focus and with a new mission, which is to prevent disparities and health diseases among the population, and a vision to create equity among Black and African Americans in the entire healthcare field. We now are focused on advocacy, education, and policy. And that is how we achieve our work here at Black Health. And this show is presented on MNN as a way to keep our viewing audience and our communities aware of the diseases and the impact within our communities. So today, I'm very pleased to be joined by our guest, who is very much involved in issues of equity and fairness, where we will be looking at issues of health equity. So I'm pleased to be joined virtually by Miss Sideya Sherman, who is the New York City Chief Equity Officer and Commissioner with the Mayor's Office on Equity and Racial Justice. Ms. Sherman leads the city's effort to advance equity through policy, practice, and programs that serve New Yorkers. She brings nearly 2 decades of equity-focused community and economic development experience, most recently having served as commissioner of the New York City Mayor's Office of Equity and executive director of the city's New York City Task Force on Racial Inclusion and Equity, and executive vice president for community engagement and partnerships at the New York City Housing Authority. But before her career in government, Ms. Sherman worked in the nonprofit sector, gaining significant equity-focused community and economic development experience at both local and national level. She's a lifelong New Yorker who holds a Bachelor of Arts degree in political science from Utica College, as well as a Master of Science degree in urban affairs from Hunter College. And Ms. Sherman, let me say welcome. And I took the time to read your very impressive background, even though it did not cover everything that you have done and continue to do. But I am so grateful that you're joining us for this discussion, because so much of the work that you do is in alignment with our mission and our vision. And before we begin, let me just make a few comments about National Minority Health Month. This is an initiative that was really started, I think, in the early 2000s, where April now is National Minority Health Month. And this is an annual observance that builds awareness about the health disparities that persist among racial and ethnic minority and American Indian, Alaska Native populations, and encourages everyone to take action to end these inequities. And so this year's theme for National Minority Health Month is Be the Source for Better Health, improving health outcomes through our cultures, communities, and connections. And it is about understanding how the unique environments, the culture, the histories, and circumstances known as social determinants of health, of racial and ethnic minority and American Indians, Alaska Native populations impact our overall health. So that is the purpose and that is the theme for this year. So to get us started, Ms. Sherman or Sideya, please just tell us a little about your work and how you became involved and interested in the area of inequities.
Sure. Well, first and foremost, thank you so much for having me. It's an understatement to say that it really is an honor to share space with you. You're such a leader and mentor to many in our city for so long. And so thank you so much for having me. As you shared, I'm a lifelong New Yorker. I grew up in the North Shore of Staten Island, in a diverse community, largely Black community. I'm a proud Head Start graduate. I benefited from many public programs, private philanthropy, institutions, right, that were able to invest in me and my future. And so while I'm thankful for that and thankful for the advocacy of my parents, I recognized from a very early age that it shouldn't be so difficult for people to get ahead in our city. And so I've had a strong interest and focus on equity since the time I was young. And it certainly has informed the career that I have today. As you shared, I spent many years working in the nonprofit sector, spent over a decade at the City Housing Authority. I led the city's task force on racial inclusion and equity. And in 2021 and 2022, was able to really help transition the work into what we have now, which is a centralized city equity office. The Mayor's Office of Equity and Racial Justice is new. We're one of the new kids on the block in city government, and we are the result of the 2022 election, where New Yorkers came out overwhelmingly and voted in support of 3 ballot measures that were proposed by the former Racial Justice Commission, which really took a deep dive into the city charter to figure out how we root out systemic inequity at our foundations within our charter, which guides our city. These ballot measures creates a new preamble for our charter that casts a vision for the city that we could be, a true multiracial democracy. It establishes our office, the role of the chief equity officer, and also requires that we create racial equity plans with all city agencies, and we're undergoing that process now. It also creates an independent commission on racial equity, which is ensuring accountability for the community and members of the public. And it also requires that we as a city measure the true cost of living for New Yorkers, right? Which is not who's in poverty, who's not in poverty, but what is the cost to live in the city with dignity? And so this is really important because when you think about not only inequity, but health inequities, this is not something that the healthcare system in and of itself can solve, right? This is the sum total of a variety of inequities that are deeply ingrained in our culture, in our society, in our laws. And so the work that we're tasked with doing as an office and that I'm tasked with doing as the chief equity officer, is to really support structural reform in our government, support reform in the ways, the core ways in which we do business, so that we begin to see different outcomes, not only in the areas of health equity, right, but economic mobility, housing, a variety of areas that we know have to really work in tandem for people to live the quality of life they deserve.
And I think we were all excited when this became a part of the work for the city in terms of the mayor creating the Office of Equity and Racial Justice. So, can you talk a little about what policies are being implemented specifically to increase health equity in the city? And is there anyone on the state or national level that's doing similar kind of work that I guess you can kind of consider yourself to partner with?
Sure. So, I mean, we're at an interesting time nationally where there's a lot of pushback in the world of diversity, equity, and inclusion, but there also is a lot of promising work happening, right? At the federal level, one of the first things that Biden did when he came into office was issue an executive order that was focused on racial equity, which tasked all federal agencies to begin to create affirmative plans to really address inequities. You see efforts at the state level, right, to address inequity in a variety of facets. And here in New York City, right, this is still core to our work. It was certainly core to New York City voters, and it's core to this administration. And so, there in 2021, the New York City, the Board of Health, right, issued a declaration of racism being a public health crisis. And there's understanding across, a variety of facets of city government as well as the city at large, that in order to address these health equities, we also have to address racism, right? It's core to this work. And so there are a number of health equity initiatives that are happening across this city. And this administration has laid out a number of bold plans and action plans and policies, particularly a women's health agenda that was launched over 2 years ago, which addresses a number of issues, including, right, the disproportionate, the disparity that we see with Black maternal mortality. I would lift up more recently, under the leadership of New York City Department of Health Commissioner Dr. Vasan, right, the city has made a commitment to work to increase the life expectancy of New Yorkers to 83 years old, right? We saw a decline in life expectancy after the pandemic. And so this is really a whole of government approach to address the things that are driving that decline, particularly the disparities that we see with chronic diseases, our city's opioid crisis, right? Issues like maternal mortality. And so this is a call to action. While this is being led by the health department, it's a call to action for all city agencies, all New Yorkers, to really take these issues head on. And what's exciting is that the city council recently adopted this into law. And so this means that not only is this the work that's coming from this administration, but future administrations will need to carry it forward.
No, I think actually, and this is one of the things that I find the work that is being done in this administration with respect to health and disparities and inequities is something certainly that I'm very much aware of because of the work that I do.
Mm-hmm.
And as we move throughout the city and beyond, to be able to talk about some of those efforts, because I think a big part of it, quite frankly, is that the message is not being
Mm.
uh, I don't know, communicated or known, even though I know that the mayor's office and you work really hard with connecting with different groups in the community and so forth. So I guess a question I would like is how can community members become more involved by gathering additional resources to alleviate disparities, but also aware of the tremendous work that
Mm.
is being done through this administration in relations to health equities and eliminating disparities?
It's a great question. So there are a lot of avenues to engage with the city on these issues, as well as to amplify, right, the work. And so one area I'll point to are the Task Force on Racial Inclusion and Equity neighborhood coalitions. During the pandemic, I had the honor of leading the Task Force on Racial Inclusion and Equity, which was really formed at the height of the pandemic, brought together leaders of color across city government to identify the neighborhoods that were the most impacted, and really drive resources to those communities. And so there are a number of initiatives that came from the task force, from small business initiatives to more like clinical health related initiatives. But one of the initiatives that grew out of the task force are tree neighborhood coalitions. And so these are neighborhood-based coalitions, largely comprised of community-based, faith-based organizations who work at the local level, to really organize, disseminate information like the information I'm sharing here today, as well as identify community priorities. This initiative is run out of our city's Civic Engagement Commission. And in addition to identifying and, lifting up priorities and sharing critical health information and other information, these coalitions also participate in participatory budgeting. They have an allotment of funding that local community members can tap into, to really lift up priorities and projects for the community. So, we can certainly share more information about that, but that's one really critical way for folks to get plugged in. I would just also add that, as an individual, the city has also created a public health corps, right, which is run out of the New York City Department of Health, which is really engaging community health workers in the neighborhoods that, again, were most impacted, right, where we've seen health disparities. And not only is that an opportunity for someone to connect to critical resources and potentially connect to care, but it's also a touch point for people to share information with their neighbors and other community members. And so there are a lot of really localized efforts to ensure that this information gets out, right? And we do want to make sure that our partners in government, community-based partners, organizations, institutions are also carrying these resources forward.
And that's where I guess I really do feel that we can all do a better job of that. And that's one of the reasons why I appreciate being a part of the Manhattan Neighborhood Network, where we bring these programs to our viewers so that they, can gain information. And I'm very pleased to often run into a lot of people who say, "Oh, I saw your show," even though it might have been 6 months ago.
Yeah.
But to say, you're talking about health equity, and Miss Sherman was on there, and I got so much from that program. That's a big reason, why we present these shows and have people as yourself on talking about it. But you mentioned a couple of things that I want to just circle back on. The Declaration of Racism being a health issue that was pronounced, I guess, by the Department of Health right kind of in the midst of COVID. Where are we with that? Because I've not heard much since the resolution was introduced. Is that still an active work? Is active work to continue to be done on that front?
Sure. And I would just add, so that was created by the Board of Health, and it sort of was a call to action to the city through the Department of Health to take a number of steps, right? And so many of those steps are in progress, whether it's creating data review teams that are more focused on identifying disparities, to making a set of recommendations, right, that went to the Charter Revision Commission that led to those ballot measures. And so that work is certainly ongoing. And I think it really underpins a lot of the efforts that you see, not only within the work that they do, but across the administration overall.
Okay, you also mentioned about the process of civic engagement that I know the mayor's office has really elevated during his administration, and encouraging people to even be more involved in the participatory budgeting process. But I'm still not seeing as much engagement as I think would be very helpful to our community and to our city overall. So, what suggestions might you make around whole civic engagement to increase participation and getting the messages out there to our community more? I know participatory budgeting, I think, concluded about a week ago, and I didn't see as much, or maybe in certain areas of our community that I would like to see. So, any thoughts about advocacy on the part of individuals as well as institutions and organizations that might help all of us in the city to become more aware, more understanding, and ambassadors for carrying the messages forward.
Yeah, that's a really good point, and an important observation. I know that participatory budgeting, even at this point, I feel is still somewhat new to the everyday New Yorker. And there's certainly a lot of effort, particularly through our city civic engagement commission, with media campaigns and bus stop ads and lots of outreach to community-based organizations. But there's still work for us to do. So I think there's an opportunity for the groups that are that coalesce around civic engagement generally, right? Good governance groups, folks who work on voting issues, for instance, to see participatory budgeting as part of that overall, as a part of a core piece of our democracy, right? The voting in a participatory budgeting project is connected to the way in which we vote in our general election. It's about our overall engagement in the civic process, as well as engagement with the public overall. And so I think there's a role for everybody to play, right? For every institution to play to amplify that. I think this is certainly something we as a city will continue to do. And when I shared the work that we're doing with the Civic Engagement Commission and creating these community coalitions, part of the reason for that is to really support local infrastructure for that purpose. So whether it's participatory budgeting or sharing information about vaccination, or that flu season is coming up, for instance, that the neighborhood groups that are often the connectors are supported, right, with financial resources, with organizing capacity, so that they can build more infrastructure. Those coalitions have been active for about 3 years at this point. And so we're still early in that process, but look forward to seeing them growing, really becoming part of like the city's permanent infrastructure, and taking on even a more active role in that outreach and education. But there's work to do. No disagreement there.
Because you mentioned a lot too about the community coalitions that have already been formed. How did you, or how did the city go about sort of expanding those? Because again, what I see even through my political life is that those who know, and
Mm-hmm.
they continue to be the ones to receive the lion's share, if you will,
Yeah,
of discretionary funds. And we, constantly had to do the same thing, find ways to make sure that those who did not know but needed to know and could benefit from financial resources. So,
mm-hmm.
could you speak a little about how even some of our viewers who may see this particular show can tap into this knowledge and
Absolutely.
receive, certainly determine if they are eligible to receive some of these resources. Can you speak some about that?
Absolutely. And I'll make sure to share our website after this, and so we can connect to all the different resources that were shared. So these community coalitions, there's a solicitation that goes out for them on a routine basis. And there's an effort, right, a specific effort to really tap into grassroots organizations, groups that may have not done business with the city before for all the reasons that you shared. And so we can make sure that people are aware of when those opportunities are upcoming, as well as make sure people know how to get involved, right? You can be a member of these coalitions, and all their meetings are public, so that folks can participate. We also have had some other efforts in our office. For instance, last year we hosted and launched a program called Unity Grants, which is run by our NYC Unity project, which is part of our office, which is focused on the LGBTQ plus community. These were capacity building grants for really small grassroots organizations that serve the transgender, gender nonconforming, non-binary community that may have not done business with the city before. We recently launched an office called NYC Her Future, and we'll have some opportunities coming up through that office as well for small organizations that are focused on the disparities experienced by women and girls. And so there is an effort to bring new organizations into the fold, to build grassroots organizations that have credibility within very distinct communities, to help them build their capacity, to increase their connections in the community, and to make sure that they're getting the resources that they need.
And you said that you would share the website. So in the minute that we have left, can you share that at this time?
Sure. So you can find us at nyc.gov/equity. And we will make sure that you have, information on some of the programs that I referenced, as well as stay up to date with us, right? As we roll out new resources, we'll make sure that those go out to you. And our LinkedIn is also very active, and we certainly make sure information is shared there.
So once they contact or reach out on this website, they will get a follow-up, right? There.
Absolutely. We have a contact form. So if people ask questions, we make sure to get back as soon as possible. Yes.
Yeah, because that's one of the biggest requests that I often hear. How to get involved.
Yes.
How can I gain more information to be a part of, activities and needs in the city where people really want to participate. One of the great things about New York and our community is that people want to get involved. But what you're sharing today, and this has been a source of great information about what you're doing in your particular office. And I remember when we first met at one of those reimagining, I think, sessions that the city was conducting at the time, and to see you now so fully invested in doing the work. And I simply want to thank you so very much, and to say that, this has been a pleasure having you join us, and we will certainly follow up on some of the good information that you have shared. So let me thank you on behalf of my office, on behalf of the city, and to say that your career journey and insights into health equity and minority health offers a new perspective for many of our viewers. And only, of course, as we have been discussing, by lifting our collective voices to educate our loved ones, our communities, and demand corrective action on structural racism in the form of policies and biases, can we amend these disparities and secure better outcomes. So for more information about the discussion today, you may contact Black Health. Visit our website at www.nblch.org. Look for us on Facebook, X, the former Twitter, Instagram, LinkedIn, and YouTube. And of course, Ms. Sherman shared her website earlier. And we thank the Manhattan Neighborhood Network that brings this show and makes it possible for our viewers to become better informed about the important topics that impact all of our lives. So I am C. Virginia Fields, and I thank you for joining us, and hope you'll tune in next time for Health Action TV right here on Manhattan Neighborhood Network. Thank you.